the session. And then I'll just go through a little bit of housekeeping in case you weren't in the first session, but I think you all were. So the session will be recorded, and I think the speaker will kindly allow us some of her slides at the end. We will keep the talk to about 25 minutes, and then we'll have 15 minutes of question time. There might be some other people who will join us because we've noticed that a number of people have actually put 2 sessions, and transition, this talk is one of them. So you might see other people joining us halfway through. Feel free to put any of your questions if you've got any or suggestions in the chat box, and we will discuss them at the end of the session. So this leaves me to introduce our lovely Kate Tolley. So Kate's going to give us a talk on psychological support for transitioning into adult life. Kate is a clinical nurse consultant in youth health, working with young people aged 12 to 25 in the hospital, community and ambulatory settings across Northern Sydney local health district. Kate has worked with young people for 18 years. I thought you looked much younger. Previously working with adolescents and young adults across the Children's Hospital Westmead in community youth health settings and internationally. She's passionate about improving young people's experience in health care and supporting other healthcare professionals. Kate is additionally employed at Sydney University to give education to undergraduate nurses in the area of adolescent nursing. Now, the surprising thing I didn't know was that Kate lived and nursed in the Caribbean for 3 years. So we can chat to her about that later on as well. So on that note, I will pass the time to you. And if you want to, do feel free to share your slides. Okay, thanks so much.
Thank you. Okay. Hi, everyone. Nice to meet you all. So I'll just share my slides. Bear with me. Okay. Can everyone see that okay?
Yes, thank you.
Okay, great. So I thought today what I'd kind of talk about was just some of the just about supporting young people through transition. And I think I kind of wanted to think about who was going to be in the room. So hopefully I've kind of created this to suit everybody's kind of needs, but happy to answer any questions. But what I thought I'd really go over today was just looking at how to make my slides move. Hold on one second. Okay, there we go. Just briefly, what is transition and some of those differences between paediatric and adult healthcare settings. I thought I'd talk a little bit about some of the common challenges for young people in moving across to adult healthcare settings and some of the common needs for young people in that transition. And then just to talk a little bit around supporting young people. I've listed a few resources and services I find helpful, but I'm happy to answer specific questions about needs and services that might suit services or individuals as well at the end, if that would be helpful. So just really briefly, what is transition? So transition in healthcare is the planned, purposeful and systematic movement from paediatric to adult healthcare settings. I think that is always our goal. I think a lot of young people that have moved across and a lot of healthcare professionals would perhaps suggest that it's not always as planned or purposeful or systematic as we would like it to be. And I think we are certainly working on that, and I hope things are improving, but we are always aware that best laid plans don't always go. So we're kind of hoping that with anybody's input today, we can take on advice to improve that a little. I think sometimes we think about transition as overwhelming or unwanted or scary. And I guess I always like to just kind of reframe that and think about how we can really use transition as a time of opportunity. And sometimes that's about reflecting on where we've come from and how our healthcare has improved, how we've grown as individuals through our healthcare journeys, and to be proud of some of those achievements and hopefully have some hope for the future. And another positive, I think transition can be a real time of increased autonomy and choice for young people. And sometimes young people have fallen into a service. Sometimes it's the only service that exists for paediatrics. Sometimes it's a service that they've just outgrown and maybe they're just ready to move on. So coming into an adult service can really be an opportunity for young people to express and communicate their autonomy and their choice, and for services to work with them in that area. So I just thought I'd put up a few differences, and this is, I guess, just some of the things that we know from the literature. So I acknowledge everybody's experiences are different, but I guess some of the key differences we tend to note in paediatric to adult healthcare services. We know paediatric services are very family-centred, so often we focus on the family or care unit that is with us, and not so much on the individual young person. Moving into adult healthcare, we often see a slight shift where the patient or the individual is at the centre of that care, and that can be a real adjustment. And just to acknowledge that that doesn't mean families are no longer included or welcome, but we may have to just be a little bit more considered in our approach to include families and whatever family is for that young person. So family may no longer be a parent, a grandparent, a carer. Family might now be a partner or a friend or somebody else that they consider their family. In terms of physical environment, I think this is the biggest change and was one of the biggest shocks for me when I moved from paediatric services to adult healthcare settings, is just the environment. So we know in paediatric services, the environment is very much set up for a child. I find though sometimes when we think about child-friendly environment, we're often aiming that at a younger child. So sometimes moving into an adult environment can feel a lot more neutral for a young person and a young adult, but it's certainly a big change in how the spaces look. They're not as friendly or bright always. One of the things we touched on just when we were having that little chat before is the relationship. So often in paediatric services, particularly in the area of genetics, muscular dystrophy, you've often been with a service or a health team for a long term and sometimes since birth. So you've oftentimes there's an established relationship, if not with individuals, with teams and services that could have potentially been ongoing for 16 to 18 years. Now moving into adult healthcare, there's new services, new teams, new relationships to establish, and that's a whole new learning curve. In paediatrics, we often see a focus on education related to illness, and that education is often aimed at parents and carers and how to support their child. We hope in transition, as young people are getting into adolescence, that starts to shift and the paediatric providers are focusing on that education for the young people themselves. But I think when we move into adult healthcare, there's often an expectation that the young person has a full knowledge and understanding of their condition on any pre-existing conditions. And sometimes I find there's a little bit of a disconnect between the expectations of the adult team and what's realistically occurred for the young person. So that's a common area. I'll talk a little bit more to that as we go on. Paediatrics, we often have a one-stop shop. So a really common message that comes through into adult services is when young people were in paediatrics, everything was done in one clinic, one level, one hospital, and moving into adult healthcare beyond transition services, it's often a much more patchwork system where you may be seeing different hospitals, different providers, different levels, different clinics, and sometimes that can feel a little bit jarring, and it's a whole new system to get used to. In paediatrics, often appointment-based systems are made by parents and carers. In adults, absolutely, that can keep continuing. So appointments can be made by whoever would like to make those appointments, but we just need to be clear on those communications of how the young person would like to work in making appointments. If we're thinking about outpatient services, I think the norm in paediatric services is often a parent or a carer or an adult would attend most appointments, if not for the full appointment, for part of the appointment. In adult healthcare, excuse me, that's not so much an expectation, but it's certainly still welcome by most clinicians. But I think that's an adjustment not only for the young person, but for clinicians when we start seeing adults and adult carers and parents in the appointment. So sometimes that's a little bit I guess of a shock for adult clinicians that are used to working with older adults. So just, making sure that we're happy to have anybody who a young person would like to be in an appointment. But I guess to that, we would often also want to spend some time alone with the young person just to be able to ensure that privacy and that we're able to answer and ask questions respecting a young person's privacy and needs. And if we think about admissions and inpatient stays in paediatric services, in paediatric hospitals, wards are very much set up for a parent or a carer or a guardian to stay bedside or on the ward whenever they would wish. In adult services, that's not always so easily set up. It's not, again, it's not a given that they can't stay bedside, but it often takes a little bit more work and a little bit more communication to get that happening. So that can be a big adjustment in transition as well. So what I've noticed, and some of the things that you all may have noticed, sorry, my phone keeps shutting off, is a few challenges in transition. And some of those I've already mentioned. So variations in services and support. So some young people may experience I guess what feels like less services or less support, and particularly when you've come from a very cohesive team. And if I think about some of the paediatric services, the team may automatically include services like social work, psychological support, and in adults that is not always the case. And again, depending on what adult facilities people are accessing, but it's not so much an automatic process as something we can arrange in adults. Another common challenge in transition is a lack of that systematic planning. So it's not uncommon in transition care that sometimes a young person's first experience of adult services might be when they've needed an unplanned hospital admission. So there hasn't really been a plan or a lot of thought put into what would happen if a young person needs an admission. They've suddenly turned 19, got unwell, needed to come in, and adults is where they've landed up. And what that means is everybody's kind of trying to scramble a little and try and catch up on what the needs of the young person are, you know, what's happened, what hasn't happened. Sometimes another challenge I find is a lack of family and youth involvement. So potentially what's happened is the clinicians have had a fantastic plan. They've very much been working on a plan behind the scenes. They're at a paediatric service working. The adult service knows the young person is eventually coming, but everybody's kind of forgotten to tell the family and the young person and ask for their input in what would they like their transition to look like. Would they like the opportunity to meet services before they make transition? Are they happy for their first meeting just to be at a transition clinic? You know, are they really comfortable with healthcare and just happy to approach it when it comes up? So I think a really common challenge is that disconnect between what the young person and the family would like to happen and what the medical team, nursing team, support team kind of thinks needs to happen. And just overall a lack of information and support. You know, sometimes I think that young people and families and clinicians aren't as prepared for transition as we need to be. It is not all lost, though. I think there are some ways we can address this. And I think the biggest thing is around cohesive, open, honest communication. And I think that's from both ends. So from paediatric services to adult services, but also including the young person and the families. Having an effective transition plan is really important. And I think that you know, it's never too late. And sometimes we see young people for the first time in adult services at 18, 19, 20, even older, and there hasn't been a plan, but I don't think it means that we can't create a plan. And there are some fantastic transition checklists that I'll include in my resource list at the end. And I think even if we're kind of getting somebody who's had no transition planning for whatever reason, it's never too late to kind of work out what can transition look like for this person, what are the needs. And I think the beauty of those checklists is it often goes through looking at what knowledge does the young person have, what are the gaps for them, and we can kind of fill in those holes hopefully in adults no matter what age they are. I think a really great resource, and I acknowledge this is not always available, but having a dedicated key contact in the adult service. So that could be a senior nurse, a CNS or a CNC in one of the clinics. So that might be the primary clinic that the young person is attending. So if the genetics clinic is your primary clinic, having a key worker in that clinic. For some young people, it might be a physio is who they see most, so having that person be their key contact, respiratory team. So just some kind of recognition of who is the service I'm most likely to use. Is there somebody in this clinic that can be my key contact? In some services, there might be positions dedicated to that. So it's always worth asking as part of that transition planning, who is the person I should contact if I have questions or if I'm not sure what's happening for my healthcare. In some facilities, there might be a youth health nurse like me. Not many facilities, as far as I'm aware. There's myself who covers Northern Sydney Local Health District. And there was a nurse at RPA, but I believe that position's currently vacant. But other hospitals do have different positions, just not a dedicated youth health nurse. So try and come to Northern Sydney and you can hang out with me. That's the best option. And then thinking about the external services, so services like Trapeze Transition Service and ACI's Transition Service. So where there's not a dedicated resource within the healthcare facility, how can we utilise those external services to help with coordination, planning, linking into the right services? And like I said earlier, just thinking about the patient, the client, the young person, you know, they should be the loudest voice in the transition process. So what is it that they need, and how can we support them and enable the young person to advocate for themselves, but also to have strong advocates around them if and when they need assistance, if the process is not working for them. So in thinking about some of the common needs for young people, I guess I started thinking about what are the common difficulties I see for young people in transition. And this could be at the time of transition, or this could be in young people that have been in our services for a couple of years, but are still in that kind of youth time frame, so under 25. And I guess the first thing I always like to mention or point out is that transition of healthcare often occurs at the same time of many other transitions for the young person. So it's a dramatic life change that's happening for most young people at this time of healthcare transition. So we're seeing a change of healthcare providers. So we're moving from a very familiar service for a lot of young people, from individual services teams that they've known for a long period of time, into completely new health systems. But we're also seeing other transitions. So for a lot of young people, healthcare transition coincides with finishing high school or moving on from high school. So that might be going to a different school, moving into university, into TAFE. It might be entering employment. So thinking about apprenticeships or workforce training or just employment. There's often a big shift in social independence as we're moving into those late teens, early adulthood years. So for a lot of young people, that's a huge transition to step away from relying on parents or carers or guardians as their primary social network into friendship groups, peer groups, and also meeting new peer groups and new friendship groups through things like schooling and employment. For some young people, they might also be transitioning into independent living, so moving away from family households into their own living situation, whether that be completely independent or semi-independent. For some young people, that might be through supported living services, or it may just be with a friend or a partner. So lots of changes in living. And then we think about emerging relationships. So again, at this age, we're starting to think about formation of adult relationships and the importance that that's now having in a young person's life. So lots and lots going on for young people, and I think often in healthcare we get a little bit focused on just what's happening in healthcare, but we need to kind of be aware of all these other changes that are going on for young people and how that could impact on healthcare potentially. I guess a really big change is often that independent living. So if a young person's been relying or getting a great deal of assistance in healthcare from family members, how is that shifting, and how does that independence into life impact on independence in healthcare? Maybe it's as simple as not having someone to remind you about appointments anymore, but all the way through to support with cares, with medication, with access to appointments. So lots of big shifts potentially for young people. And as healthcare providers, sometimes we think, oh, you know, what's going on? Why are they suddenly not making appointments, not coming in? you know, what's changed for this young person. And sometimes it's just the real practicalities that we need to go back and say, what's changed for this young person outside of healthcare? Is there any gaps or supports that we can put in place for them? And I guess the other really big need for young people is mental health needs. And I think this is not, I guess, specific to young people with muscular dystrophy or any other chronic illness, but we know mental health disorders are the most common illness that we see in young people aged 12 to 25. So mental health disorders have the highest comorbidity and the highest presentation rate to hospital out of any other illness type. So mental health disorders are common across the youth spectrum. If we look at some data in Australia, in the younger adolescent group, so 12 to 19, around 16% of young men and 13% of young women have a mental health disorder, have had a mental health disorder in the last 12 months. And overall, if we look at that 16 to 25-year-old age group, around 1 in 4 young people have a mental illness. And when we look specifically at young people with chronic illness, we know young people with chronic illness are more likely to develop mental health problems. And that rate has been reported as high as 4 times higher than the general population. So lots of additional concerns. And again, that plays out across all aspects of health and wellbeing, not just adherence to the medical treatment that we're particularly focused on. I guess if we think about some of the common mental health conditions we see in young people, the 2 most common are depression and anxiety. You know, depression typically characterized by low mood, irritability, loss of interest in activities, sleep changes, fatigue, and change in function. And then anxiety, you know, that overwhelming kind of sense of worry, and that could be focused on a particular issue, or it could be a more generalized worry and stress for young people. And that's often exhibited by decrease in concentration and attention. Some young people may experience some physical changes, so increased heart rate, nausea, sleep difficulties, shortness of breath. And if we think about some of the common presentations in young people with chronic illness, it can be really easy to miss some of that or to explain that as part of their physical condition. But often that, you know, we just need to be thinking broader and looking at the big picture for young people as well. If we think about types of anxiety, we kind of look at some specifics like generalized anxiety, social anxiety. Something I do tend to see in young people with chronic illness are things like post-traumatic stress and phobias that are sometimes related to some of their experiences in healthcare in the early ages. But also obsessive compulsive disorder and panic disorders as well. So a whole spectrum, I guess, of mental health needs, and depression and anxiety are just 2, but the most common that we see in young people in Australia and with chronic illness. So what does that mean for young people in our clinics, in our hospitals, any young people that we come across? And for me, I guess I see my role as complementary to the physical and medical care that's provided by the doctors, physios in the clinics. And I think part of my role is remembering to advocate for all aspects of all aspects of wellbeing for young people in transition. So thinking about how can we complement our medical care with psychosocial assessment and supports for young people. And I guess what that means for the young people who are attending their clinics is hopefully we're spending some time asking about that, and that can be delivered in a few different ways. So we might think about using a wellbeing questionnaire, and there is a statewide youth health wellbeing questionnaire that young people may be asked to fill out on attendance to clinics. It may be through a conversation with either the doctor or another healthcare professional, and really we should be thinking about all of those psychosocial aspects. So thinking about home, housing, education or employment, looking at activities and peers and social supports, and moving on to some of those more late adolescent, early adulthood concerns around use of alcohol, other substances, thinking about relationships, sexual health, sexuality and gender, and importantly, mental health and well-being. So I think as we move into transition care, it's really important that we consider what's going on for the young person as a whole. What are emerging changes for the young people, and what are potentially some issues that have been long-standing that we need to think about how we're going to approach and support now that they're in adult care services. And I guess, again, being mindful that the types of supports available in adult healthcare may be different to the paediatric setting. I think for me, I always like to focus for a young person on how do we build resilience and strengthen protective factors. And we know some of those really important protective factors include things like supporting young people in education and employment, thinking about peer groups, and that includes peers with similar lived experiences. So that may be thinking about peer support groups or chronic illness support groups for young people, and also thinking about how we can help support young people to continue the things they enjoy. So sports, hobbies, their relationships, supporting independence. And then for young people, thinking about how we can keep them safe. So how do we talk about safer drug and alcohol use and harm minimisation in that space? How do we think about safe sexual relationships for young people? And I think this is a component that's often missed, particularly in the chronic illness space. I think we get very focused on what are the physical needs for this young person, and sometimes we're not as mindful around the sexual health and the drug and alcohol space. And I like to think that's where I can come in, but obviously that's something we all need to be thinking about for young people. And really importantly, how do we support carers? Because this is also a huge transition often for parents, guardians and carers of individuals. And they might be struggling with their own transition, 18, 19 years. Their primary role has been, how do I keep this young person safe and healthy? And that's a huge shift for them to take that step back and allow the young person to have autonomy and independence in healthcare, but also in life. So I think it's important we don't underestimate the change that the parent and the carer is going through. And we know that young people rank their families and carers as one of the key relationships in their lives, and that doesn't change. And I think we can all kind of relate to, even as adults, there's times where we just need mum or dad or nan or auntie or somebody that we can call and say, hey, can you help me with this? So, just because a young person is in adult healthcare, the importance of family doesn't go away for these young people. So again, how do we support the carers to support the young people? Just being mindful of time. How are we going? Oh, great.
You're fine.
Okay. So I guess I just thought I'd just run through a couple of support options and then really just open it up to questions, because I think that's probably the most valuable to be able to kind of answer specific questions. In my role, I really try and tailor how can we put in the correct supports and services for providers and also for young people. And I think often the first step is, are they eligible? Is the young person eligible for support through a specific transition service? So the Trapeze Transition Service is dedicated for young people who have been through the Sydney Children's Hospital Network. And I find that most young people at the genetic and muscular dystrophy clinics have come through that pathway. But for young people that have not had access through Sydney Kids Hospital, so by that I mean Sydney Children's or Westmead Children's, then ACI Transition Service is available also. A really great resource that I've been utilising a lot is thinking about the university and TAFE students support services. So for young people who are moving on into university and TAFE, linking them early with the support services there. Often in primary high schools, in high school, there's been a whole host of support that's been put around young people from a very early age. Things like learning support, support teachers, just some of those physical support needs that may have been put in place. And moving into university, that can be a big change. But there are fantastic services in universities. So I always encourage young people, as soon as they have knowledge of where they'll be going, to connect early and have an interview early with those support services to see what the university can support them with. You know, sometimes they can put in place things like scribes, extra time for exams, physically supporting young people to get around the campus. So I think it's a really great mental health. Depending on what adult services you're accessing, there may be access to psychology services in-house, but otherwise I tend to think of what are the local supports for young people. I'm aware that, you know, often young people travel to come to our clinic but don't reside within our local health area. So I'm always thinking, what other services available externally for them close to where they live. Headspace is always a really great start. They're a youth mental health service. They work with young people aged 12 to 25. It's subsidised by the federal government, so that just means there's no cost to individuals. And while they don't focus on specific illness types, you know, all of their services employ clinicians that primarily work with young adults, so they're very aware of the needs of young adults. The other great thing about them is they have excellent pathways to other services. So if they're not the right support, they're always kind of aware of what's in their area to help support young people. Another service I've been using quite a lot lately actually is the Northcote Sexuality and Relationship Education Service. So they're a really great service for young people who are entering adult relationships and are interested in having a physical relationship with their partner. So they are a fantastic service that young people can access to enable you know, education, but also to physically enable young people to enter like sexual relationships with their partners or casually. And in terms of drug and alcohol, again, I think it's important we remember that young people with chronic illness are still young people, and they still engage in the same you know, adult behaviours that all of us engage in, or most of us have engaged in at some point. So thinking about how we can ensure young people are safe if they're choosing to experiment or use alcohol or other substances, and just being aware of how their unique needs need to be met. So often I'm thinking about, you know, what additional information might this young person need? You know, is alcohol likely to impact on other medication they're taking? Do we need to think about things like falls? You know, using your power chair while you're under the influence, is that safe? What extra dangers come about for young people? So a good resource just for general information is Your Room. But obviously if young people have specific needs, then we would think about the local drug and alcohol services. So that was kind of it for my formal, I guess, presentation. I just wanted to give a big overview really, but happy to take any specific questions that anyone might have about supporting young people in transition.
Thanks so much, Kate. That was very informative and you were perfectly timed. So I'll ask, I've got one question here, and anyone please feel free to ask more questions. So this question is regarding adult multidisciplinary neuromuscular clinics being relatively rare at the moment, whether you have a medical specialist resource that includes, for example, adult neurologists, respiratory physicians that have an interest in neuromuscular conditions. So this is from a pediatric care point of view, like where do they send their patients?
Oh, big questions today. I might have to get back to the question on that one. I mean, off the top of my head, I'm not aware of specific teams. I think, Christina, are you? You might know more about that.
So I think Concord and Ronald Shaw currently have the transition clinic, but we are aware of clinicians, for example, in Campbelltown, we've got Dr. Gopinath there. We know some respiratory physician, both in the St. George area and Wollongong. Otherwise, at the moment, it's more individual in terms of where the young person lives. And then we move them to a combination of clinicians within their local area. It might be a little bit difficult if they have specific care needs that needs more specialized care. For example, a patient with SMA requiring kind of nursing type of treatment, then they might elect to go to a more local a tertiary centre for the injections and perhaps more locally for other care needs. Yeah, so I don't know if we've answered that question well enough.
No, and I think it's a really common challenge, again, across, all areas of transition and chronic illness, is finding services for the young person's needs. I think ACI transition are always a really great support with that, because what I've found in the past is if they are working with a young person where there isn't a designated clinic or transition service, they are able to advocate for the to, I guess, put together a bit of an ad hoc team. So finding, whoever the key provider needs to be, and then working with them to work with the other providers in their area. So sometimes that can be some of the benefits of working with a transition service, is they can help to advocate and support to ensure the young person gets all the services they need as much as possible locally. The other thing I think that has been a positive of this year is the opening up of telemedicine and virtual healthcare. So I know prior to, or certainly for our area, prior to COVID, it was very limited how we could access telemedicine. And I think for private providers, how they were able to bill for that, and I guess that's a consideration for private providers. And I think some of the changes this year have meant that accessing services out of area through telemedicine have become easier. And it's my understanding that they're working towards thinking about how can we keep this going now that we've got all these systems up and running. So that could always be another avenue, potentially, is tapping a little bit more into virtual healthcare and telemedicine for young people that are out of areas where there's a service.
Yes, and the comment is Sandra does find ACI and the peace service actually very helpful. I guess Muscular Dystrophy New South Wales is also another resource. So if you have patients or family or friends who might be looking into transition, another option is to touch base with MD New South Wales. They might have staff who would know or ask around, where the appropriate physio might be, or the OT might be, or the relevant clinician might be. At the moment, we haven't got more questions that's on the chat box. But I might just ask, actually, Kate, one of the difficulties is actually getting the young person to stay with a mental health service. And like Headspace seems to take in patients, but they often don't follow them unless necessarily longer term. And then if the patient is like 26 or just over 25, then they're very stuck. We don't know where to get them unless to pay for a private psychiatrist or psychologist.
Yeah, it is a real challenge. One of the services or resources that I do use a lot is the Primary Health Network. So depending on which area you're in, so for us it's Sydney North Primary Health Network, they also have a mental health triage service. And part of that is that they can subsidise care for young people that are unable to afford care. So they, whichever primary health network you're part of in your area, can be a really great resource in looking at what are the free and low cost and subsidised services in your area. And if you utilise their mental health triage line, they can sometimes connect young people directly with that. They can also subsidise a certain amount of private sessions, so utilising the mental health treatment plan. The problem with the mental health treatment plan is most private psychologists then charge additional to that. So there's often a gap payment, and it can range from, I've seen from $20 to $140 gap for the young person per session, which is considerable. I don't know a lot of people who can afford that. I guess my key tips would be always try and negotiate with the private psychologist. So most private psychologists will hold space for a certain amount of clients at a time that they don't charge a gap. So often that is young people or people of any age that have a healthcare card or any additional needs or have low income. So I think it's always worth contacting the psychologist directly if you're looking to go private and just asking, is there any flexibility on prices? I think the real challenge is that mild to moderate health difficulty. I think when young people have severe challenges in their mental health or are suicidal, the system is better set up, but that mild to moderate often does rely on that private. So yeah, I guess my key points would be if they're under 25, thinking about Headspace. If they're over 25, looking at the primary health network triage line and seeing if they are eligible for any of those additional funding supports or negotiating. And sometimes as part of my role, I will try and advocate for young people. Often local youth services have some knowledge of the clinicians in the area that are a little bit more open to negotiation. The other services are ones I've mentioned. So university and TAFE often have their own psychology services in-house. So for young people who are in university or TAFE, then that could be a good outlet. I think the problem with the limited sessions is most services who offer free or low cost do that using the mental health treatment plan. And that is only the 10 sessions per year. Yeah, so it's a challenge. I guess I can just really discourage people to contact their local support, their local kind of key person in the area, and hopefully they've got a little list they can tap into. But it is a real challenge across the board for young people and not so young people to access mental health support.
Yeah. Thanks for that, Kate. Now, we've got a question from Diane to everyone. As in, how would you suggest helping young adults with doctor's appointments when they feel that they are an adult and should be able to make all the decisions, but do not have enough understanding? Kate, I think that you can answer that.
Yeah, absolutely. And again, I think this is part of that preparation, isn't it? So I guess ideally we've started that process in early adolescence to start kind of gradually expanding the time a young person has with the doctor without a parent or carer. In terms of legal rights, I guess it is the young person's legal right to see a clinician independently, but I understand where the frustration comes from parents and carers who maybe are seeing their young person making decisions they wouldn't necessarily be making. I guess I would encourage people to be open with their concerns to their young person and express what their worries are, why they feel that they might need additional support in those appointments, and maybe come up with a little bit of a plan over time. So maybe a gradual step back. So could I come to, maybe I'll just accompany you to your first appointment and I'll come in for the beginning and then I'll leave you. Next time, maybe I'll drive you there, but you can go in independently. So maybe a bit of a staged approach to helping a young person achieve that independence in sessions. And I guess just that open communication, what are your concerns? And I think it's a big learning curve for parents and carers as well as individuals and young people around how we negotiate. And sometimes, it's not going to be perfect and there might be some, mistakes made, but I guess being that support in the background to be there and help support them when things maybe don't go to plan, and how do we make this right moving forward. I guess if you have serious concerns about your young person's health, though, speaking to the clinicians, they might not always be able to give you all of the information back, but expressing your concern, if I guess from my perspective, sometimes a parent might call and say, look, I know they haven't been to the last 4 appointments. I'm really worried about them. What can you do? I can't make them come to an appointment, but maybe then that initiates a phone call from me to say, oh, hey, we're just aware you've missed a few appointments. Is there something going on? Is there something you need extra help with? So I think, be open and honest with your young person, but also bring those concerns to their healthcare providers if you're really worried about them. Hopefully that helps.
That answered the question, Diane. I don't know. Feel free to unmute yourself to talk as well, because we're a small group. We've got about 3 minutes before we get kicked out into the main room. But in terms of getting the young person, I'd also say from an adult kind of doctor's point of view, if we knew that the young person may not be as on par with making decisions or understanding, we tend to go the other way, like we neglect to sometimes check with the young person as the main decision maker. We often defer it to family always wanting to come in with the young person. And I think Kate actually taught me that maybe save some time for the young person on himself. So we might meet together and then get the parents to go out and then talk to the young person so that they can have their time. Sometimes we're able to have a separate time with the young person as well, and then the parents separately, and then bring them back together so that we're all on the same page. Or at least that's what we're hoping for.
Sorry, I don't have a picture there. I don't know what's happened with my camera, but yes, I was in the position where I had to ring up the clinician because my grandson forgot that he could not take a certain medication, and he is not always fully honest with what meds he is taking. And I had to ring up to, he didn't tell me about this particular appointment, and I had to ring up and ask the doctor to look back on his Westmead. But because we hadn't had a proper transition, even though we had a lady who was transitioning people at the disability services, I couldn't get him